The Thompson test is pretty well 100% sure way of detecting a ruptured Achilles tendon. So the Achilles tendon attaches the big gastroc and the soleus muscles to the heel. All right. So if I take and I squeeze onto the gastroc muscle bulk, you can see how her foot goes into plantar flexion because I've actually now pulled through the Achilles tendon. Okay, so she's going to plantar flexion. So she is attached, which is good. Which we could tell because she would go up on her toes anyway. But when you have somebody that comes into your clinic and said, yeah, I felt like somebody kicked me in the back of the calf and then I couldn't walk properly, they can still actually they can still walk and everything, but they just can't really push off. And this happened to Christina last year, right? And she unfortunately didn't get it. Chuck, where did she anyway? That girl. Yeah. Anyway, so unfortunately she's not here because we could see if there's a difference, even though she's healed, if there's a difference between the two. So it'll be interesting to see what she's like. Okay. So when you have somebody that has an Achilles rupture, you won't get any movement. Okay. Okay, the Holman's test. I often, because we're kind of the first line of medical people in the Winter Club, I often get people coming up and having had no trauma, but having this calf pain. And no trauma, calf pain is a little bit of a bell inside your head, okay? Because you can develop deep vein thrombosis in the calf area. In particular, if they've had a fracture somewhere else. Some people, again, depends on age-related as well, can be throwing off these thrombosis. And so what it is a blood clot in your deeper veins, okay, or arteries. And so that is a danger thing as well, because it can then come loose and travel further up into the heart or lungs and brain, and then you could actually have more problems. So it's important to make sure that you rule it out. You can look at the foot area, see if there's any pallor, because if there's not proper circulation coming through the area, then they have pallor. They also usually have some swelling. I'll often see some swelling in the area. And so it'll just look a different contour from the other side. You can check the dorsalis pedis pulse, and that will give you a bit of an idea as to how well the pulse is doing. Are they getting the proper circulation through? We used to do basically this kind of a test or a squeeze test. And those tests are now considered too dangerous because it could disrupt the thrombosis. So all we now have the patient do is pull up actively into dorsiflexion and ask if that recreates the pain. However, if there's still any question because they've not had any trauma, they haven't had, like they didn't wake up in the middle of the night with a cramp type of thing, it's better to get them checked out than not. So really what has to happen, they have to go to either walk-in clinic with their own doctor, emergency, maybe not necessary, but they need to get it looked at sooner than later. And then there's a special ultrasound, it's called the Doppler ultrasound that they do in order to detect that deep vein thrombosis. Okay? But just think, anybody that comes in with calf pain to your clinic, there's really no good reason for it to be there. You want to double check that. Okay, flip over on your back for me, please. So somebody that comes in with plantar fasciitis, one thing that you can do that sometimes recreates their pain is to pull up on the big toe. Okay, sorry, I shouldn't do it on that bunion one. Let's do it on the other side. Is to just pull up onto the big toe. And often you'll see, oh, Noreen doesn't have any problems in there. That's awesome. Like there's no bowing. When you guys do this on each other, you'll feel that there's often a big strip of very tight tissue that comes in through the bottom of the foot. She's got nothing. It's so nice and they're flexible. Awesome. So she's not a good one to demonstrate this on, but as you pull up on the big toe, you can look for two things. One is you can look and see how far you can take the big toe. If you can't take it to a 90-degree angle, it means that the structures underneath the bottom of the foot are a little bit tight and should be loosened off. So we really try and work to get that great toe going up into a 90-degree angle. So you can look for great toe flexibility, but you can also look underneath the foot to see if there's any rigidity in there. Okay, and sometimes if it's very acute, it will even recreate the pain because you're stretching on that plantar fascia. I'm not sure if your pages are out of sync, but mine were, so it should be on number 5 here, okay?
Yeah.
Okay, so the squeeze test for Morton's neuroma. This is where you can, the Morton's neuroma or the metatarsalgia will cause pain here. So all we're doing is we're squeezing across the metatarsal phalangeal joints like this. If you recreate that electrical sensation, that could be the Morton's neuroma. If you're just recreating pain, it could be the metatarsalgia because you're squeezing these metatarsal phalangeal joints here. What you'll often see in the metatarsalgia as well, and I'm surprised that you don't have some because we have 2 arches in the foot. One is the longitudinal arch, the other is the transverse arch. And this one has fallen on her, so it's flatter than it should be. So she's actually got callus formation under that second toe, which tells me that that's probably where she's taking off of. The callus formation is way more underneath that toe than it is underneath the first toe. So normally you should be taking off underneath on the first toe. That's your strongest bone, your strongest muscles are in there. So if you're taking off on top of these smaller joints here, eventually you start getting pain in these smaller joints. Okay. And so that's ones that you need to, there's a really great technique that I'll show you next time. Just making up this little pad that stimulates PD1, I swear, as well as supports that arch in through there. And so it's a good one to use for that. Works really well.
Can you do exercises to strengthen that fallen arch?
It's really hard. If you strengthen the whole underside of the foot, it's going to help to a certain extent. But once this goes, it's hard to strengthen. Like you can't, there's no muscles that come across to strengthen it back again. So really what we do is we just give people strengthening, general strengthening for the arch of the foot, your inversion guys as well, because your tibialis posterior muscle comes down, patches into so much there that it helps to maintain the arch. But this arch is very hard to strengthen compared to this one. So, yeah, a little harder to do. Footwear is important, obviously, so that's a big thing. And I think it's partially because you've got this bunion, so you don't weight bear on your bunion. Right?
Does she have it on either side?
She has it on both feet. Okay.
So are you saying that where you get calluses that you should be looking at how you're walking?
That's probably telling you how you're weight bearing, because calluses are formed from constant pressure on an area, right? So skin thickens in order to be able to withstand the pressure and the trauma to it, so to speak. So yeah, so it's telling you that's where she's weight bearing. Okay. So she's got some callus formation in the heel, which is normal, so she's landing on the heel. She's taking off more through that middle toe. And you'll see sometimes people with the longer middle toe will do that as well. And she's got a longer middle toe than she does her great toe as well. And that's not abnormal or anything. That's right. Okay, so we're going to do general ligament tests, all right? So we can test our lateral ligaments. What we're going to do is hold at the tibia fibula, okay? So not down below those malleolus, but you want to make sure that you're holding at just above or right over top of the malleoli. And then you come in just underneath the malleoli, and then you're going to recreate a passive inversion, which is going to test the lateral ligaments, okay? And then if you flip yourself around, you can use my back, same position for my hands, okay? Just at the malleoli, just below the malleoli, and then you can do a medial stress test for the medial ligaments, okay? Taking them into eversion. Okay, flexibility tests. The great toe extension we've already done, so that is number B under 7. Let's go to the calf one. So I'm going to get you to stand up. I'm going to bring my handy dandy little right angle ruler and stuff. We're just holding it.
the wall.
Okay, so this is going to be kind of close, but not going to be exactly at a right angle. So what you do is you make a line on a piece of paper, take your big toe and just place it up to the line. Okay. Then what we're going to do is take your knee, bend it forward as far as you can. Just make sure to poke you in the eyes with this. It's a little longer than what I normally do. And then you can take either a plumb line, okay, or something. Okay, there. Sorry, it's a little longer than it should be. Something that measures straight down from the knee, okay, as long as her heel is down. So that's where she comes to on the right. Now we get her to redo it on the left.
Doesn't that depend how far she bends?
That's telling me kind of a combined, how much is she moving through the ankle, the forefoot, how flexible the calf is, the lower part of the calf and the Achilles. Watch your eyes again there. What this is really useful for is, look at how much further forward she comes there.
It looks like it's in an angle.
Yeah. Is it? Yeah, it could be. I have a right angle device basically that just, yeah, you're right. There we go. If I look at you from the side, you're almost equal. Okay. Okay, so she's pretty equal. Just ignore that one because I had it at an angle. What I have at my clinic is a basically right angle. And so you lay the one along the floor and then the other one comes up to the knee, and that works really well. So she's pretty close to exactly equal. So what you can see, especially after after an ankle sprain, is that they won't be able to get as far into that dorsiflexion. This is just kind of it's a really nice tool to be able to tell you, are you getting that ankle better? Is the motion coming back? It's also kind of good for the patient because then they have a more of a visual. They can see, oh, look at how much I've improved. You know, I was way back here to start with when I first came in to see you, and now look, I'm way up here. And they get really excited because they can definitely see the change. Okay. So it's just a kind of a handy little tool that you can use to measure calf flexibility. Yeah, and no worries, because basically we've done the hamstring and the quadricep flexibility before, right? So the hamstring is the straight leg raise, quadricep is the one over the edge of the bed. All right? Thanks. Sorry to keep you guys late.